Welcome back. Malnutrition affects the lives of thousands of children and women in Maghreb. The situation is getting worse with the worsening of living and economic conditions, food insecurity, and the decline in food aid, which has made many families unable to provide the necessary needs for their children. This report has more details.
The suffering of millions of families is exacerbated in Maghreb Governorate, where the specter of malnutrition threatens women and children. Deteriorating living and economic conditions have led many families to reduce the quantity and quality of their food, which has had a negative impact on the health of many families, especially women and children. The child Mariam has been suffering from severe malnutrition for months and has been lying in the nutrition department at Kura General Hospital as a result of the lack of sufficient food and her family's inability to provide it.
My child is suffering from malnutrition and was hospitalized here. The spread of malnutrition is due to the high prices of food supplies. Citizens are not able to feed their children nutritious food. They cannot afford buying their food essentials.
The suffering of Mariam and her family represents the tragedy of thousands of families in Maghreb Governorate who are struggling with the specter of malnutrition that threatens the lives of their children. Every day, the nutrition department at the hospital receives more than 40 cases. These numbers increase day after day, as dozens of cases lie among the corridors of the department, some of them in critical conditions. Nutritionists attribute the reasons for this increase to two main factors: the lack of health awareness among some mothers and the deteriorating conditions of many citizens in the country.
During the last period, the number of cases suffering from malnutrition has increased significantly, especially among children, due to the worsening economic and living conditions in Yemen. We receive around 40 to 45 cases on a daily basis.
According to a report by the Public Health Office in Maghreb Governorate, more than 9,000 cases of malnutrition among children and women were recorded during the past period from January to June of this year, with more than 2,500 cases suffering from severe acute malnutrition. This poses a real threat to the lives of vulnerable groups, and this crisis is exacerbated by food insecurity and the decline in humanitarian aid, which makes the displaced people face difficulty in obtaining adequate food and the necessary health care.